Good afternoon and welcome to the 40th Flint Community Webinar on Coronavirus. This Friday, December 18, 2020, and what a year it has been. I am so excited that you joined us today. I'm your moderator, Yvonne Lewis, and on behalf of the Healthy Flint Research Coordinating Center, we want you to know that we have a very, very exciting and important conversation for you today. We appreciate you joining us and all of our partners who've joined us each week. As you know, the Healthy Flint Research Coordinating Center is a multi-institutional partnership with the University of Michigan Flint, University of Michigan Ann Arbor, Michigan State University, community-based organization partners serve the community. The National Center for African American Health Consciousness and other community leaders are here to bring quality information to you to help us to understand how we're going to navigate this corona experience, I'd like to call it now, since it's been going on for so long. We'd like to remind you today that you can put questions into our queue, but we also want you to know that if you've joined us by YouTube, you can send us an email or send us an email at info@healthyflint.org, or you can give us a call at 810-835-2130, 810-835-2130 if you have questions that you'd like to add to our conversation today. We acknowledge and appreciate those who have come from various places, even across the country, to be a part of our webinar today. And we hope that this information we bring to you will also help you wherever you are listening today. Our intention has always been to bring relevant information about this pandemic and all the other things that are going on in Flint to us as a community, so we know how to respond adequately. And we are continuing to make that an effort and an intention of our weekly webinars. Today we're going to have a conversation, and we're calling it a roundtable. We told you even in our announcement about that we were going to keep it real. This conversation in the next 30 minutes is always going to be about vaccines, what we know and what we don't know. And this is going to be real talk. So we don't have a lot of slides for you in this segment, but we do want to encourage you as we're in this conversation, please be a part of the conversation by putting your questions in the queue. The panelists are there to respond to your questions, and some of those we'll bring forward for our conversation. So today, we've heard on the news, and I'm going to ask us to go to gallery mode right quick and for all of our partners to be here. You've heard on the news, and some are excited about this and some are a little trepidatious about this, that vaccines, COVID vaccines are available. Now, last week, if you were here with us in the webinar, Dr. Sue Wolf has been our specialist on this fruit basket, telling us about the vaccines and the viruses. We're going to ask her to do a recap as we move into the conversation, because she showed us a pineapple last week and the spikes on the pineapple and how that related to corona. So Dr. Susan, we're going to start with you today and want to keep this real. So you make it make sense to us. Help us to understand this virus and how they've utilized it to even create vaccine that we're going to talk about today.
Well, thank you so much, Yvonne. Since last week, I ate the pineapple. So this week I have to have just a picture of the pineapple rather than the actual thing. But what we were pointing out last week was that for the flu virus, if we think about the flu virus as different fruit, like an orange and a mandarin, they're very similar, but they are different forms of it that cause the flu. And to get the virus, they either kill the fruit and use part of it, or they really weaken it and use part of it, or they just use pieces of the outside. And that's how they make the vaccine, to help our bodies learn how to fight against that virus. Why we chose the pineapple for the coronavirus is that if you remember all of the pictures that you see about coronavirus, it has these spiky proteins known as spike proteins or S proteins. And that is what it uses to help it attach to our cells. And so that is what the vaccines want to cause us to be able to recognize that spike protein and be able to learn how to fight against it before we actually come in contact with it. And so for the vaccines for coronavirus, what the vaccines do is they deliver the instructions for making the spike protein. So not the actual, they don't take anything from the coronavirus per se. They take the instructions for making that spike protein, and they put those instructions in our body. Our body makes a little bit of it and learns how to fight it off, so that when we come in contact with the actual coronavirus and that spike protein, we are ready to go and fight it off.
So you say take instructions now. So you mean when they develop this liquid form that they're putting into our bodies is actually not the virus itself, so it can't make us sick? Because that's a big question now for a lot of people. Now you give me this and then I'm going to get sick. So help us to really understand, because people do have reactions. Does that mean they're getting sick from the vaccine?
Right. So the vaccine isn't making you sick, but remember, it's training you how to fight. So when your body starts fighting off an infection, that's when it mounts a fever. So you might get a fever and it shows, your immune system is kicking in and beginning to learn how to fight off that virus. And so you will get some of the soreness because of the inflammatory cells, the fighting cells, that infantry coming to the site to help fight. So you'll get maybe redness at the site, or you'll get the fever. That's showing that your body is learning how to fight off the virus.
Thank you. So we're going to ask some of our other panelists to come in, because I've got a question. You talked about these vaccines helping us learn how to fight off the virus. So I wonder, Dr. Deb, Dr. Reynolds, does the vaccine stop us from getting the virus because we got the vaccine, or does it just stop us from getting sick? I mean, we've had only a little bit of time to talk about these vaccines before we're actually being asked to, some of us are being asked to take them. So what do you say about that, Dr. Deb?
Well, I think Dr. Susan Wolford can chime in on this too, as well as Dr. Reynolds. We've got the evidence. It looks like it will prevent most people from getting sick from the virus. It doesn't mean it's absolute protection from people necessarily being able to spread it to others. And if you weigh it out, it's better to have the vaccine than not. It will decrease chances that you can spread it, and it will greatly decrease the chances that you'll get really sick or have a really bad outcome. I'll hand it over to Dr. Reynolds, who on my screen is right here.
Yeah. Better to have it than not. Come on.
It is the vaccine, as far as we know now, will prevent severe illness.
Yeah.
Okay. And that's a good thing, because when you get the severe illness, you risk losing your life, but you also risk becoming disabled. Now, what we don't know for sure is, does the vaccine keep you from passing the virus in your upper airways on to somebody else? And so that's why we still have to have this layered approach to protection. And I got this picture out of the New York Times, which is very clear. Imagine you've got about 8 slices of Swiss cheese between you and the environment. Not every hole in a slice of Swiss cheese lines up with the next holes in the other slices. So you have this layered approach to protection. So you have your personal responsibilities, and that's physical distance, staying at home if you're sick. You have masks. You have hand hygiene and cough etiquette. You have limiting your time or exposure in a crowded situation and avoiding touching your face. Then you have the other layers, which are shared responsibilities, which is ventilation, outdoor, having air filtration. You have fast and sensitive testing and tracing. And then you have, among the shared responsibilities, government messaging and financial support. Then you have quarantine and isolation. And then you have vaccines. So what I'm saying is, not one thing is the whole armory. When you step out there, you better have the whole armor of COVID-19 infection protection. okay? And it's a multiple layer. Now, people will say, well, it's not 100% effective. Well, I'm pretty comfortable going with a 95% shot, especially when you look at my age and you look at the people I associate with my age. And as I've told Yvonne, I got a 92-year-old mother, and I'm not taking anything to her that I can avoid. And I have to be around to take care of her. And then I'll lastly say to the brothers and sisters, Social Security was designed for us not to live as long as some other parts of the population.
Come on.
I want to be around to get as much of my Social Security and pension as I can, since I never got 40 acres and a mule.
All right, doctor, you brought a whole nother level into this
No,
conversation.
and I want him to get my Social Security because his generation is going to eat up my generation's Social Security. So I'm with him. And I love that analogy of the 8 layers of protection. You're right. None of the layers are perfect, but if you put them all together, you've got a screen up.
Yeah, so this is a whole lot to think about, Doc. I mean, I know you gave it to us very succinctly, very, very clearly laid out, but is there some place that people can go to, because, you know, we may have to digest this a little bit so that we can think about it. Is there a website? All of us don't do websites, but where can people go to find this and look at it for themselves?
Quite actually, I was looking for a webcast of the NAACP's webcast that they did 2 nights ago, where they had the vaccine researcher, the head of the vaccine research team, who happens to be an African American woman from North Carolina. They had folks from Stop COVID-19 Now. They had the dean of Meharry Medical School, who actually signed up to be part of the test population, and several others. And once I can find a website, I'll be glad to share it, and I'm sure it will be coming up again. And you have to read reputable newspapers, because not everybody reads science journals.
That's right.
And actually, MLive does a decent job. However, we can also say our county health department, our state health department, and I'm hoping that in the future, everything will align with what's on the CDC website.
Dr. Reynolds, this is Suzanne. I'll jump in and say, if you go to www.gchd.us, click on the COVID-19 button, it will take you to the COVID-19 page. On the right-hand side of the page is the vaccine button that you can press. We have videos, we have the FDA guidance on how vaccines are produced and the process that we have to go through. And there are a number of videos that talk about the COVID-19 vaccination. So please feel free to go there and take a look for additional information.
So that's the Genesee County Health Department website.
www.gchd.us, click on the COVID-19 button. You'll get to the COVID-19 page. On the right-hand side of the page are many other buttons, and at the top, you'll see COVID-19 vaccination. Click on that button. We have information in multiple languages. We have a number of videos that can be viewed. There's some infographics there that talk a little bit more about how the FDA does the process of research in order to get to a vaccine, and we'll be adding new materials as they become available. It also has the guidelines. Remember, there are different vaccines that are coming out into the marketplace, and many of them are going to have different recommendations for who should get them and what kinds of side effects there might be. So again, that information will be posted.
So you bring up a good point, Suzanne, for us to explore a little bit more. That is, there's more than one vaccine company. And so if I get, and so I'm gonna leave it to you doctors to talk about this, because there are different companies. Moderna, we're hearing Pfizer, we're hearing Johnson & Johnson, we're AstraZeneca. How are we a community to make sense of all of this? And I know everybody's not going to get them all at the same time. So let's talk about these different companies for a little bit.
So it's really interesting. There are three main vaccines to consider. The one by Pfizer, the one by Moderna, and the one by AstraZeneca. The ones by Pfizer and Moderna are very similar in the way in which, remember I said they deliver the instructions to make the protein. They both deliver it in a very similar way. They put it in a little fat bubble and put that in the vaccine. That's a new way of doing vaccine delivery, but it seems to be working very well. They both tested their vaccine in very similar ways as well, which is why they know that they prevent severe disease, but they're not entirely sure whether or not it stops the ability to maybe transfer it, as Dr. Verhoeven said, right? So they tested it in very similar ways. The main difference that people are speaking about between the two is really about how they're stored. So the Pfizer one has to be kept mega cold, just really, really cold. And that's a tricky thing to do, but they've worked out how to do it. The Moderna one can be kept in your regular refrigerator. So, but Moderna, yesterday, the FDA were, well, the advisory group said that it should get the emergency approval. And so that one will be available soon. The third one, the AstraZeneca one, isn't yet available. They chose to deliver their virus, their instructions in a little bit of a different way. They took a virus that doesn't cause us any problems, put the instructions in the virus, and put that into the vaccine. And that's a common way of creating vaccines. We've done that many times in the past. And that one seems to be working well as well. They did their study a little bit differently. And so from that one, it seems like that one not only stops severe illness, but actually stops infection as well. Because of how they tested those, they are more able to say that. But all of them seem to protect very well. And so it really will come down to, in many cases, what's available to us. And at the moment, what's available to us is the Pfizer one. And it doesn't seem like there's any major advantage to waiting for something else to come along.
Dr. Reynolds, I see you ready to jump in.
Oh yes. Dr. Wolford said it very politely. I'll just break it down this way. Get what's available when it's available, because there are unforeseeable production and distribution issues that may come up as we develop this rollout. Understand, we have to immunize, what is it? Oh, at least 200 million people, if not more, twice, if we go with the first two. And so you don't want to delay getting as much protection as you can. And as vaccines develop over the decades, the influenza vaccine has developed over the decades. So, you know, now we have a extra strong dose for senior citizens, a quadrivalent dose. In other words, it has 4 components. So there are vaccines will continue, the development will continue, and perhaps what we get today will be different than what our children may get 2 to 4 years from now.
Okay,
All about reducing risk, and that's the key thing here. You know, these are emergency use authorizations, and we know that the vaccine is at lower risk than somebody having COVID-19. So it's important that we talk about what those risks might be.
So, and I was going to go to you, Dr. Deb, because you got the epi part of this. So when you talk about the availability, 2 doses, the amount of people that have to be vaccinated, so kind of give us a easy way to understand the background and why that's important.
So when we hear the numbers, 94%, 95%, that's based on a particular protocol, right? It's like if you're on a weight loss program and you're supposed to eat lots of fruits and vegetables and exercise for an hour a day and get sufficient sleep, but you decide, well, I'm not going to exercise. Or you say, I don't have time to sleep, you know, the required number of hours a day. If you take any one piece out of it, then the effect that you can expect will change, because the numbers that we're getting are based on a particular protocol. And for the Pfizer vaccine, I believe it's 21 days on average between the first dose and the second dose. And then for the Moderna vaccine, you have to get that second dose in 28 days. So you only get one dose, and you don't get the second dose. Those numbers that we've seen, the 94%, 95%, are based on people getting those two doses and getting those two doses within a specified time frame. So if you don't follow the protocol, you don't get the full effect, right? Go back to the weight loss example. You might lose 5 pounds when everybody else in the group who did the program as designed lost 10 or 15 pounds or decreased their body fat by a lot. So if people want to get the maximum benefit from the vaccine, they have to take it as designed. And we're also being told that you can't mix them. And I don't think we really have that problem, because the people who are providing and administering the vaccine, they know what you got. And we've got protocols. So when you get your first dose, don't leave without having your scheduled appointment for your second dose.
Exactly.
And what can you do to serve yourself in between that first dose and that second dose? Continue to honor the protocols and make sure you've got a plan, like no kidding, to get that second dose. If you don't have a car, make sure you've got your transportation lined up. If you have a job that you don't have a lot of availability for time off, make sure you get that scheduled. Make sure you leave the first appointment with your second appointment already set up, and make sure that you get your life organized so that you can, like no kidding, get that second dose in the time frame that's laid out.
I
And
know
it's important.
I'm sorry, go ahead, Suzanne.
It's important for everyone to know that all of the immunizations that are given are going to be recorded. So they will know exactly what you received, so that the second dose that you get will match the first dose. But you'll also be given a card that will tell you which manufacturer you're getting, so that you also know which vaccine that you've received.
Thank you. Now we know what we're telling you right now is a little futuristic, because the vaccines are not readily available to the general population.
Yes, they're
So we just
coming.
want to plant these seeds right now, because this first phase of the vaccinations are actually going to go to a specific group. But I want to get to a couple questions in the queue, and then we can talk about how this phasing is going to happen. But someone wants to know, if you've had the COVID virus already, can you or should you get the vaccine?
Yes.
Yes.
Yes, the recommendation for the Pfizer vaccine and in general is that everyone should get immunized. So the answer to that is yes. And so we want to make sure everyone's aware of that. But again, remember that if you're feeling symptomatic, you want to wait a little bit before you get a vaccine.
So this is really important, because I've had people say to me, well, I've had COVID and I'd had the antigen test, which means I've got the antibodies, so I'm good. You're laughing at me, Doctor.
Well, let's say it could be worse, but it's not good enough, because you may not have the protective antibody, the antibody that will kill the virus. So I wouldn't take that risk. And
I'm sorry,
levels.
you brought in a whole different concept. What do you mean protective antibodies? I've never.
Well, first of all, there's antibodies that will neutralize or destroy the virus. Then there are those that are less effective. They're antibodies that may attract helper cells, which is another part of the immune system. But most importantly, do you really know how much antibody you have, and will it be protective? And the best way to know is get the vaccine,
We
because
also,
it's demonstrated.
we also know that this is a novel virus. So we don't know, if you've had COVID-19, what protections you're actually getting from having it and how long those protections might last. So it's important to get the vaccine.
Okay.
And let's be total in full disclosure, it will take time for us to be sure how long the vaccine lasts, because remember, as kids, even as people my age, we had to go out and get a tetanus diphtheria booster, right?
Yep.
Pertussis booster. So we may need a booster, but that's not a reason not to do it. That's just more reason to do it, and do it again if necessary.
Yeah,
I
like the flu shot.
Dr. Verholden, and then Dr. Susan. Did you have something you want to add to that, Dr. Deb?
The only one thing I will say is we've now seen some recurrent cases in the US. And this question around, and I really appreciate having Dr. Reynolds and Dr. Wolford on. I honestly, I've never met a not cool pediatrician. I would say I wish I had them as my pediatrician, but my pediatrician was like awesome too. That we've seen now recurrent cases. And one of the things that's a little bit different about COVID, again, a new disease caused by this virus that we're understanding, is that we've had cases where people's second infection has been worse than their first infection. And that is something that we're not used to seeing so much. Normally, what we see is once you get it the first time, if you get it subsequent to that, a lot of times it's not as bad. This is a new virus. We're learning it. So this question about if I've already had the vaccine, if I've already had the illness, should I get vaccinated? I love Dr. Reynolds' example because if nothing more, then it gives you the type of antibodies that you need to effectively fight it off and avoid a severe form of the illness. I think that's worth it for people. I think that's worth it.
Dr. Susan.
Oh, I agree. I think that we just don't know enough about the illness right now to say that you're protected for life because you had it. So taking the vaccine would be the safest way to go. And we know that taking the vaccine cannot cause the illness because those instructions are not for making the whole virus, just for making the little spikes. So you cannot get COVID from getting the vaccine. And so that would be the recommendation, to get vaccinated.
So here's a couple other questions in the queue, and because there are people with, and I heard this also in one of the reports about people with immune compromised systems should not take the virus. So one of the questions is, being the process for those with the pre-existing autoimmune diseases, the body is already fighting to, in way, let me say it exactly right, fight mode. It's already in fight mode. That what will the vaccine do to those individuals if their body is already in fight mode? Are they encouraged to take the vaccine?
So I think that if you have an autoimmune disease or you have an impaired immunity in some way, you should definitely speak with your physician about this. But again, the vaccine can't cause the illness. So in many cases, they will be advised to actually get the vaccine because they don't want to get the illness. And we need to find a way to protect them from doing that. So they should definitely check with their doctor. Many cases it will be that, yeah, this can still protect you.
So one of the other things is, we know we're right now talking about the 2 doses because those that are the ones that have got the emergency use authorization, which I want to come back in just a second and talk about this emergency use authorization so we understand that. But there is conversation that Johnson & Johnson is developing a 1-dose vaccine. So because this is out in the future a little bit, should people consider waiting? And I heard you already, Dr. Richards, I hear you, for the 1 dose, because then you don't have to worry about going back for another appointment. All right.
It's about risk reduction. And again, realizing who's most at risk. And that's the reason why the vaccines are being rolled out in phases, that those that are most at risk will be immunized first, because we want to keep them from getting sick from COVID-19.
And remember the 8 layers of Swiss cheese.
Yes.
You put on the whole armor of Swiss cheese when you step out there. And the vaccine is one part, and you should get whatever you can when you can.
I want to ask a question too, if you don't mind, Yvonne.
Sure.
And I think I know the answer, but I'm going to ask our physicians this, which is that if I get the 2-dose vaccine now, and I'll just be fully forthcoming, I'm really disgusted at the global inequity that I'm seeing in vaccine distribution. We've created big global inequity in that all the superpowers, all the big boy countries have purchased up a lion's share of the vaccines. And don't get me wrong, I want this to be available for everybody equitably, but we have global inequity. And as I think about it, a 1-dose vaccine that doesn't have the same storage and transportation requirements and being stored at these really low temperatures that require special freezers. I talk about our first world problems, right? These are very first world problems for us, but in certain parts of the world, These things are going to be major. So I am literally on a crusade that when we do have that, we have global vaccine equity, number one. And the countries that are most at risk and also most vulnerable and high need have equitable access to it. So I think also, in your good citizenry and in your own core values, think about it. We have the vaccine now. It's been rolled out to us ahead of a lot of other places. And if you have to get a 2-dose vaccine, I really do encourage people to make sure that they organize and govern themselves accordingly so that they can get it. I don't think this is one of those scenarios where you want to wait. And there will be a global equity movement to make sure that our brothers and sisters abroad are able to get what they need. And a 1-dose vaccine that doesn't have to be stored at a very low temperature, that doesn't have all the supply chain and distribution demands, I would argue that our brothers and sisters abroad need to be at the front of the line for that, because the big boys have jumped to the front of the line in this early phase. So and I know people have a lot of questions and doubts, but I do ask for people to think globally in this context as well. We have something now that will provide some safety and protection for us. And we're trying to be the trusted, credible messengers to let people know that you're okay and that this is okay and this is a good thing.
I think that idea of the global equity is so important. And that's why it's important to have more than one vaccine. So for example, the AstraZeneca one, whereas I think the Pfizer one is estimated at a $20 per individual cost. Of course, it's supposed to be free to people getting it, but the government, I suppose, is paying the $20 a dose. The AstraZeneca is infinitely cheaper. I think it's something more like $4 a dose, and doesn't need the cold chain issue. It doesn't have that cold chain issue, the issue of keeping it very cold. And so a lot of the other countries where that don't have the resources of the US, and some of our colleagues are in line to get the AstraZeneca one.
Thank you.
I might add to that.
Dr.
One of the hopeful, encouraging things is that the Biden administration has committed to rejoining the World Health Organization. So not only will it be our individual preference, we pediatricians, we want everybody to get immunized. So that would be a step forward. But remember that first world, third world dichotomy. We have third world conditions in the USA. And here's an ethical, challenging question for all of us. Now, if congregate living is what you see in prisons and jails, does it not make sense that those who are imprisoned and in jails and in ICE detention areas get immunizations first if we're talking about
Absolutely.
equity?
And that's in
Absolutely.
the plan. And again, as things move forward, I think we need to have more conversation about the rollout of vaccine and the prioritization based on risk. And any congregate setting poses more risk.
And that's such an important question, that issue of prioritization. So in the hospitals, for example, at first it was going to be those working in the ICU, but then those in the ICU have the PPE, they are protected. What about the receptionist who doesn't, who's coming in contact with them? What about the person who's cleaning the rooms of the people who have? So there are lots of discussions to be sure that the right people get it first.
And
And
what
that
about
includes
teachers?
teachers, grocery store workers that stock the shelves for us, anyone that works on a road crew that tries to keep our infrastructure up. There are a lot of people that are really essential in keeping us moving forward.
Yeah.
I want to thank you all. I know we could spend a whole hour on this, but we do have some other really critical information that we want to share today. I want to thank you, Susan, Deborah, and Lawrence for your candid conversation here in your respective roles. We appreciate that. I want to also say we have a number of questions in the queue. Some of them we've been able to get to and not. So I want to encourage you to continue to look in the queue, ask our panelists, please respond to these questions because there's some good ones, like the long-term implications of COVID. We still don't know. Someone says it's a virus so new that we don't know a lot of things about what's going forward in the future. So I want to encourage you, stay tuned, come back to the webinars. We've got more good information for you. This panel and others will be back in the coming weeks to talk more about these issues that you're raising. Remember, one of the other things we have is what's in the queue. So when you put your questions in, you send us those questions, we keep those in mind, and that helps us to guide the future webinars. So thank you to our panel. And I'm going to ask you, Dr. Deb, stay on because I've got a big question for you. Don't go away, Dr. Reynolds and Dr. Susan, because we'll need you later. And Suzanne.
But one last question that we didn't talk about is when should you get your influenza shot if you're going to get your COVID shot? And I remember reading something, I don't remember the details, but if we can't answer it this week, we'll bring it to you next week. But
Yeah.
maybe Dr. Wolford can help me with that.
Right. And we do have a little piece. Yes, sir, Dr. Reynolds, that's right. Because I don't, yeah, that's a big question. We really need to come back and talk about that.
But the one thing about that is many of us are not even able to get the COVID vaccine just yet.
Right.
We are all able to get the flu vaccine. So if there was just one take home, it would be get your flu vaccine. They missed the chance to get the flu vaccine and a free turkey.
Yeah, that was earlier this
Shout out to Hamilton who threw in the turkey with the flu vaccine. But there are multiple opportunities. So get the flu vaccine now, and then you won't have to worry about that.
And we will give some updates on where you can get those flu vaccine in addition to some additional COVID tests. But Dr. Furholder, now let's make the distinction. Last week you told us that you're not a medical doctor, you're an epidemiologist. So that's why we also need the medical doctors here. But you've got some information for us. Last week you started sharing with us about this policy brief and how we're looking at the data for Flint, Genesee County particularly. Can you give us an update from what you started sharing with us last week?
Yeah, sure. So we've been talking a bit about a lot leading up to Thanksgiving, and I feel like we did major efforts and outreach in Flint and Genesee County and all across the state to try to prevent super spread following Thanksgiving. So I want to give people just a little snapshot of where we are and the holiday / post Thanksgiving phenomenon, as I call it. That's not my slide.
No, it's not.
It's not. This looks like I think my wonderful assistant who has a really tough job. She's the one who runs the slides for us. It looks like she might have last week's slides up.
Yeah, that was last week's.
All right, no problem. So I'll just give folks a little quick snapshot of where we are as far as this week. The short version is there's some things that we know. And when I say things that we know, I mean things like that we know and we know them, like we know. And so we know that holiday travel and we know that social gatherings will increase the spread of COVID. What we did, I think, in Genesee County, as far as we can tell, it looks like we did a pretty decent job. But I want to just give people the numbers. The cases have more than tripled. The COVID cases have more than tripled over the last month. So if you compare, and here, I'll just pull these up real quick and give Tay a chance to make sure she's got the right slides there. We know that these social gatherings and travel lead to increased community spread, and that is at an all-time high. We've all seen the news. You know, yesterday, I believe we had just under 3,400 COVID deaths. The cases have more than tripled in Flint, in Genesee County, and all across the state since October. We won't be able to fully understand the post-Thanksgiving effect for at least about another week. And on a positive note, based on the data that we have now, 81 of the 83 Michigan counties, including Genesee County, saw decreases in COVID cases last week when you compare the cases from the previous week. What that points to is the many things that we did, people not having these multi-household gatherings, people limiting their travel, people making tough decisions around, and I love Suzanne Kupel from the health department's example of yeah, I wanted to be with my family, but instead, because I'm out and I'm working every day, she made arrangements. She went and picked up food, had kind of a contactless, low risk, short visit with family so that they could still figure out how to fellowship, but not increase the risk of spreading the virus to one another. So there is some good news. We saw a decrease last week. It'll take us about one more week, because if you are COVID positive, by the time you start to show symptoms, you've been exposed, you start to show symptoms, then you go get your test, then you have to wait for your test results to come back. Sometimes that process takes 2 to 3 weeks. And you don't get counted as a case on the day your test results come back. You get counted as a case the day that you took the test. So that data is ongoingly being updated. So my big recommendations for folks: stay the course, limit the social gatherings, and limit your travel for the holidays. We have to stay the course. Continue to practice good protection and honoring of the protocols, masking up, washing your hands, avoiding the social gatherings, and practicing physical distancing. And again, we've got great strategies that the state has put up for us, as well as the county. And you can go to michigan.gov/coronavirus to understand more about strategies to keep your family safe, especially during the holidays.
Thank you, Dr. David. I appreciate you answering that question, because the question is, why the delay? How come we don't know more quickly? But we have to wait on the data. And you mentioned something to me earlier. We were talking about this, and I do think it's important to mention that sometimes the information isn't loaded up in the same week, and you have to come back the next week and get all that information from the State Department. So it's important for us to try to understand how this really works.
Well, and we got some other good news too, Yvonne, which is that we had some disparities in the time that it was taken for
Yes,
test results to come back.
exactly.
And we're hearing some good feedback, and you have some stories yourself, right?
I do, because and I want to thank the health department, our state health department, MDHHS, and the Genesee County Health Department, and those of you that actually shared with us what was going on at the different sites. As a result of that, we had a quicker turnaround last week. I had a staff member that works with me went and got their test at Macedonia on Monday, and Wednesday morning had the test results. I got my test done on Wednesday at Word of Life, and this morning my test results came back. So for those of you that are wondering how it's working, they are actually listening to you and making some changes, and this is out of that. So thank you all for chiming in. Now, thank you for sharing this. We're going to look at the post-holiday effect, but one of the things, I'm going to ask Billy Mitchell and Dr. Reynolds to come back to talk with us for a few minutes, because the City Hall is still making arrangements for us. And then Dr. Reynolds wants us to really understand the importance of keeping our homes clean and disinfected during this time. So Billy, can you give us a quick update on what's going on with the city?
I don't know if I see Billy on.
Oh, okay, did I miss it? Well, Dr. Reynolds?
He's not quite as beautiful as she is, but he sure is smart.
Yes, Billy is my partner. She is the manager of public health, and so I'd be crippled without her. But what I will say is, first of all, you need water for personal hygiene and cleaning your household. And Flint residents can apply to save up to $225, that's $75 per month on their water bill. So if you have any questions, you can check the City Hall website, and you can also call 410-2020, 410-2020. And that's all she's authorized me to say.
Okay. Well, Dr. Reynolds, you sent me a note last week, and we weren't able to get to it, about cleaning and disinfecting your home and some recommendations from CDC, because we recognize that some of us do have family members who've been diagnosed with COVID, and we have to care for them, isolating ourselves and doing the social distancing. But there's some things that were provided by this website that you shared with us to help people understand how to prevent getting sick, disinfecting their homes, even if they have a person in their home that is tested positive.
Oh, yes. Now, the first thing is, if you don't listen to anything else I say, do not mix bleach with any other household cleaner because you don't know what that chemical combination will do. The only thing you can mix bleach with is water. Everybody hear me on that one? Say amen. Okay, so you can make your own disinfectant if you're low on cash or if you run out, and that is, it's 1 cup of water to, I'm sorry, 1 cup of bleach to 9 parts water. Or you could say 1 ounce of bleach to 9 ounces of water. Shake it well, perhaps label that bottle, and most definitely put it out of reach of your children. That's the pediatrician talking, because all of these cleaning agents can be toxic or poisonous to kids. So that's why we lock up our cabinets anyway and put everything out of their reach.
Yeah.
Okay, so soap and water, dish detergent, and warm water are good for cleaning. And it's essential that we practice this. Now, you have to be careful about what disinfectant you will use on what surface if you're concerned about appearance and color and all those things. So check the label carefully and understand if a label says antibacterial, it does not necessarily mean it's antiviral. So don't waste your money when you know bleach will do the job, bleach and water will do the job. And I mean on inanimate surfaces. In other words, not on people, not in people, contrary to what you may have heard a few months ago. Bleach is not to be ingested. So you can use various cleaning agents. And then it goes back to, well, how do you live with someone who's in isolation or quarantine? And they should be in their own room. Okay. Yes, you need to clean the doorknobs and the light switches on a regular basis. If you only have one bathroom, yes, you will need to clean at least the doorknobs, the toilet, the sink, and the light switches, and perhaps have them carry their toiletries in a little container so that they can take those things and move them back to the room where they are in isolation or quarantine. Uh, Laundry detergent works well on clothes. So hot water and laundry detergent for washing your clothes will kill the virus. The bottom, and oh, I forgot to say, we're still talking about Swiss cheese. So you wear your mask, you maintain physical distance.
Okay.
This is just another layer of that 8-layer Swiss cheese sandwich we're talking about.
Yeah. So thank you, Dr. Reynolds. I want us to come back to this in a future webinar because there's more to talk about this as well, because there was also a conversation with some health professionals that we should switch off a little bit because changing from some Lysol sometimes and the bleach and water and other times. And there's some reasoning behind that. So I look forward to having you back, Doc, to talk about this a little bit more.
Do not mix
the two.
Anything else.
Exactly.
And keep it out of the reach of children and your crazy relatives.
Thank you, Dr. Reynolds. Need to bring Suzanne Cooper really quickly up to talk about what's going on. Suzanne, I know we talked about previously that some of the sites that we're going to be using are closed. So you've put something together for us coming up on Monday that gives another option for for people to get their vaccines because the sites will be closed during the holiday. So can you give us a quick update on these things, Suzanne?
We all know that having access to COVID-19 testing is really important in our community. And knowing that we have holidays before us, we wanted to have a pop-up testing site added to what we currently have so that there's more access to testing during the holiday season. And we've been very fortunate to collaborate with MDHHS, the HANU team, that provides the services at our 3 community testing sites, and Jim Milanowski and his team at Genesee Health Plan. So we are having a pop-up testing drive-through, and it will be at the Genesee Health Plan, and it will be the nasal pharyngeal swab. So we did find that out last night to confirm that. We will be doing this from 9 to 4, Monday, the 21st. Again, Genesee Health Plan on Linden Road in Flint. And again, a shout out to Jim Milanowski and the team at GHP for all their collaborative work in getting this up and running.
Okay. And now, Susan, just quickly, we want to review the sites that are available in the community because they are still going to be open. However, we did put up, after this, we did post the vacation days or the holidays that they're going to take. So any insights you want to give on the testing sites?
So again, the Word of Life, Bethel, and Macedonia sites are all run by the HANU team through MDHHS. Again, we have holidays. There's Christmas Eve, Christmas Day, New Year's Eve, and New Year's Day. So we want to make sure that you're all aware that those days, those sites will not be up and available for service. So that is the reason why we're working on the pop-up testing, and then we may have other pop-up testing during other holidays as we move forward through COVID-19. We also remind everybody that there are testing locations, the Rite Aid sites in Flint and Swartz Creek. We still have the Walgreens in the city of Flint, and Hamilton is functioning at North Point Clinic at the Burton Fire Station. And again, recognize that the Thursdays are both Christmas Eve and New Year's Eve. So be mindful of that and be mindful that they will not be open during the holidays for those timeframes. But there are other days of the week that the other sites are open and available. And again, Yvonne has mentioned this two-way conversation. I want to say to all of you, it's so critically important that you share with us any problems or challenges that you experience at any of the testing locations. We will work very hard on the other side, making sure those are addressed and that we make the experience as comfortable and quick and simple as is possible for everyone.
Suzanne, thank you so much. I do want you to spend just about a minute talking about the plan, because nationally, we've been concerned about there not being a plan about how this works. But you've talked to me on many occasions about the fact that here in Genesee County, there is a plan in place to address these emergency types of issues that we have. Just give us a real quick understanding about the planning that goes on and all the meetings that are happening to help us be ready to do this work that we're seeing right here.
So since 9/11, there's been so much work that's been put into what are called emergency preparedness plans. And one of those plans that is a long-standing plan is for mass vaccination as necessary, be it H1N1 or something else. Also for events like an anthrax situation where we'd have to give people medications so that they would not get anthrax. Those are just two examples. We plan for these things on a regular basis. The plans are all in place. It's the logistics, these not knowing when we're going to get vaccine or how things are going to move. That's the piece we don't have. But the infrastructure, the planning structure, the framework for doing vaccination, our team at the health department does flu clinics just as GHP and other partners do on a regular basis. It's the same process that we use, and it's those same plans that we work on regularly that we pull out and we utilize as the framework for doing COVID-19 vaccination.
Thank you, Suzanne. I just got a question in the queue that I want to bring forward. Jim Melanowski, please keep putting those questions in the queue. Jim Melanowski is on. He's the CEO of the Genesee Health Plan, and you mentioned, Suzanne, about the work that the health plan is doing. in partnership. But the question is, this past week on the 15th was the last day for people to enroll in the marketplace. And the question is for you, Jim, what do people do now if they missed it? Can you just share with us quickly?
Sure, Yvonne, thank you. Please just contact us. There are special circumstances, special enrollments. If things change for somebody, like their marital status or where they live or those things. So, we could certainly still assist people in that. What's nice is that we still have the Genesee Health Plan. So people can get on that type of coverage if they miss these deadlines and they need healthcare coverage. We can do that. We can always sign people up for Medicaid and Healthy Michigan. So we have a lot of options. So they just give us a call.
Thank you. Thank you so much, Jim. Appreciate that. Now, as we start to wrap up for today, there's some very important things that we want to tell you. There is another really wonderful opportunity that was presented for our community last week. The Flint, Moving Flint Forward. This is a small business grant program. We are now at December 18th. You have a few more days, I think about 12 more days if I count right, to apply for this funding. This is an opportunity for $10,000 grants for small businesses located in Flint. There are 10 particularly earmarked for minority-owned businesses. December 30th, you still have time by 5 p.m. to apply for this funding. If you need some assistance, please contact Tracy Joseph at tjoseph@flintandgenesee.org. This is important. We talk about the need for our community to be shored up, to be supported. This is an opportunity for us, small business grant program right here for our community. In addition to that, we want to remind you that CEUs are available for this webinar. We're excited that every week community health workers are applying for these CEUs, and we appreciate you being on to get the information that's being shared. A number of you are on today. So those continuing education units, which is short for CEUs, for community health, or CEUs means continuing education units. For community health workers, please continue to apply for those units. Immediately following the webinar, you're going to get a pop-up evaluation, but we want you to like us on Facebook. We got something really special for you coming up next week. So we need you to go on Facebook and like us on Facebook, and then be sure that you also join our YouTube channel, subscribe to our YouTube channel, and give us a call at 810-835-2130 for more information. Now, again, as I said, immediately following this webinar today, you're going to get this pop-up evaluation. The pop-up evaluation helps us to be sure that we're responding to the questions that you might have. So please put those in as soon as you hop off the webinar. It might be a couple minutes, but that will be up there. Dr. Deb, I see we got something exciting coming up. We want to spend a few more minutes on this, a couple minutes on this today. So let's talk about, we got 2 minutes. All we have is 2 minutes. What's going to happen next week? We've been here 40 weeks now.
Yeah.
And we've had people say, what are you going to do for Christmas? Because it falls on a Friday. What are you doing for New Year's? Because it falls on a Friday. Well, we want everybody to enjoy family as you can, Zooming them, phone calling, FaceTiming, whatever you're going to do on Christmas Day. But what's going to happen on Saturday, Dr. Deb?
So on Saturday, the day after Christmas, we're giving others and ourselves the day off to, enjoy the holiday the way people choose to do that safely. And then we're going to have a raw, uncut, real conversation. We'll be able to talk about what was the post-Thanksgiving effect. We'll be able to let people know. We'll have a lot more information about vaccines by then, because by then we will have had a good 2 weeks of vaccine administration in our community. And we'll be able to answer all of their questions, uncut, raw, and real. We're going to use a slightly different format. We're going to just be broadcasting live on Facebook. Anybody who's participated in the webinar, we're going to email them a link for how they can join in. And we ask people to share that link. If you want to kind of get a primer, you can go to our Facebook page right now on facebook.com/HFRCC. Like the page. As soon as we go live, if you do that, they'll automatically get a prompt on their social media that this thing is live. And the cool thing is they'll be able to interact with us too. We'll be able to pull people in from Facebook into the conversation. So we tried to make it more exciting and interesting. So I really want people to do that. And then right after this, you can hop onto the research seminar and hear about what have we learned in these 40 weeks.
Yeah.
The power of this webinar is not in the, people that are presenting. It is in the relationship between the community, our stakeholders, and all of us. And I just do want to tip my hat to you, Yvonne Lewis. And I know you don't like this, but I'm doing it anyway, for all of the tremendous amount of work and leadership that you have brought forward to make sure that in these trying times, our community has good, trusted, credible information. People might not know, but you spend a tremendous amount of time talking with people, pounding the pavement, getting us all organized. So we really acknowledge and honor and appreciate you. So you enjoy your day off on Christmas, because
Thank
the
you.
day after we'll be here.
We're back. Yeah. And so our time is up right now. So thank you, Dr. Dare. We want you to really just, when you sign off here, come into the research seminar. Good information is going to be shared there too. We look forward to seeing you again next week on Saturday, though, the 26th, for our post-Christmas Facebook community activity. So we appreciate you all. Have a good weekend. Enjoy your Christmas, and let's talk some more next week.